This is my dream job because our emphasis is not what the emphasis of normal retail pharmacy is. Our emphasis is taking care of the patients. And you know, I kind of had an agreement that as long as I did what was best for the patients, it was acceptable. So that's my entire goal, is to do what is best for our patients every day, and not to make money necessarily. So I've had the opportunity to do that, notably with one patient who had just been discharged from the hospital, and he comes in and he said, "Well, I just got discharged from the hospital." I said, "Well, what happened?" He said, "I had a heart attack." I said, "You had a heart attack and you're out today?" He handed me his discharge papers from the hospital, and he thought that he had a heart attack, obviously, and turns out he didn't even understand what had happened to him in the hospital. He had actually been diagnosed with congestive heart failure. So, you know, this is just an example of a patient who not necessarily was not taken care of or given the opportunity to have this knowledge, but something didn't sink in. Something, his transition from being an inpatient to an outpatient to chronic disease management, it didn't occur the way it should occur. So, you know, I was able to kind of sit him down, explain what congestive heart failure is. He didn't have an understanding of that, what that meant for him in terms of lifelong, what he could expect from the disease progression, and what kind of changes that he could make to positively affect his health. Maybe that would have happened at some point. Maybe a physician or a nurse somewhere would have, you know, changed that. But at the point that I saw him, there was no point at which he was going to understand the implications of his diagnosis. And I feel that I was able to do that for him.